Now, the idea behind health insurance doesn't seem to be all that complicated. Yet for some, it seems to be a very difficult idea to grasp, and I'm not sure why. Now, that includes members of the Freedom Caucus to even House Speaker Paul Ryan doesn't seem to understand. And of course, to add to that list is Fox News host Brit Hume. Now, during a discussion of the GOP's healthcare plan designed to replace Obamacare, Hume had criticized compelling insurers to cover people with pre-existing conditions. Now, he did that while talking with Fox News Sunday host Chris Wallace and Dr. Ezekiel Emanuel. Now, he called the coverage of those with pre-existing conditions not a triumph, but problematic. Let's take a look.
And remember this, Chris. The triumph of Obamacare is this coverage for pre-existing conditions, which basically defeats the whole idea of insurance, which is, for example, if in the automobile insurance market, if you could wait till you had a wreck and then buy insurance and have the repairs covered, that's comparable to what we're doing here.
Britt, if I have cancer...
Hold on, let me finish. Can I please finish?
The
idea of insurance is that you purchase it to guard against risks and things that may occur in the future. It's not that you purchase the coverage after you're already sick.
But if
so once that idea is gone, Obamacare is essential. It remains.
First off, there's a couple of problems with this argument. First of all, people aren't fucking cars. Health insurance is not the same as auto insurance. Okay. Now look, this whole idea that getting a pre-existing condition is like crashing your car, and using that as an idea or as a reason to deny people affordable insurance is bullshit. It's not even comparable. First of all, again, you can fix cars, but you can't always fix people, right? Because they're not the same. And we shouldn't treat the markets the same. The health insurance market is not the same as the auto insurance market. Oh, and by the way, for the auto insurance market, you seem to be missing one similarity. You always tend to leave that out when you make this comparison. Auto insurance is mandatory. Just saying. Anyway, getting cancer is not equal to crashing your car on purpose. Now, those with pre-existing conditions, many of them have them for the rest of their lives. What Brit Hume is saying is, hey, man, that's still your fault that you got that pre-existing condition, even though some of you might have been born with it. Hey, you shouldn't have gotten sick in the first place. It's your fault. That means that you should pay more. Simple as that. Well, the other thing is here, and that leads into why he's wrong, is that, again, insurance is about making people who are healthy pay premiums to cover people who are sick. That's part of what insurance is supposed to be. Now, some of you think, well, that's not fair, man. Well, the thing about this is that someday you will also be sick, and that the premiums paid for by healthy people will go to cover you. That's how it's supposed to work. You have this pool, and, you know, everybody pays into the pool. And then when you're sick, you take more out than what you put in. That's how it's supposed to work. That's sort of the point of insurance. And the way the system is set up is so that sick people can access healthcare with their health insurance. That's the whole point. Now, it's also, insurance is a for-profit industry. So the companies come in, they skim some money off the top of their premiums, and they do whatever they can to try to deny people coverage. Now, that's actually why I'm for government-sponsored insurance, because it doesn't have a profit motive. There's no advertising costs. There's no reason to skim money off the top because there's no profit. And there's also minimal overheads. Now, the ACA, as flawed as it is actually a better system than not having healthcare, but it's nowhere near as effective as a single-payer system. Now, the reasons ACA is flawed are not the same reasons that the Republicans are saying it is. The criticisms of Obamacare are a result of a for-profit market-based insurance system. Now, in another video that wasn't part of this, one of the guys defending the repeal of Obamacare says, well, what we need is patient-centered market-based care. What does that even mean? What does that even mean? Like, those are just nothing but bullshit buzzwords. It sounds, market centered, patient-based healthcare. Well, that sounds very vague, because it is vague. It doesn't actually mean anything. All it really means is that we're going to get the government out of it, and that means, as a result, you're going to have less people that are covered because you can't afford that insurance. That's the ultimate goal of this. Now, unfortunately, that market-based insurance, it already is expensive, and it's already inefficient, and it already leaves people out. Now, we have a solution. Progressives do. It's called Medicare for All. Now, Republicans have a different solution. It's called kick the sick people off insurance who can't afford to pay for top dollar insurance. So that only healthy people are paying in premiums, and therefore health insurance companies will make a gigantic profit. And those healthy people, they'll save a little bit of money until they too get sick. And then, oh, sorry, man, you have a pre-existing condition. Your premiums are going to go way, way up. And they're not going to be able to afford it, and they get kicked off the system. That's what they're doing. Basically, Alan Grayson was right. Their healthcare plan is die quickly if you get sick. Now, of course, Republicans will say, how dare you say that about this? That's not fair. That's not what we're trying to do. We care about people. Really? Well, dying from lack of health care and access to health care is a result of these Republican policies. This bill throws 22 million people off insurance, cuts Medicaid by $700 billion. You don't think it's going to kick people off the insurance? Of course it is. You can fudge the facts all day, but unfortunately, that's what you're going to have, is less people being able to afford insurance. You have higher premiums, less people can afford it. You have no Medicaid or drastic cuts in Medicaid. You're going to have less people being able to have Medicaid, and that's going to lead to thousands of people dying. Now, they come back with, you bring up these facts, they come back with, well, just go to the ER. You still have health care. You can go to the emergency room. Can you, though? But the ER, yes, is an option, but you can't go to the doctor, and it's not the doctor, and it doesn't treat chronic conditions, and it only takes care of the symptoms, not the root causes behind the symptoms. You go to there, they'll just refer you to something else. And, of course, not only that, but it costs a lot of money to go there. And if you can't afford to pay that, well, that cost gets passed along to people, ironically, who have insurance coverage. So there's that. Either way, you'd be screwed under a Republican plan. But again, thankfully, there is another way, and it's gaining a lot of popularity. And that is, of course, Medicare for All. Now, ironically, all it took was Republicans to show what their plan really is and how badly it sucks for a majority of Americans to wake up and finally see that single payer is the real solution. Hey, everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.